Yes.
Yes.
Not as much as some of my nurse colleagues. 0.3 cc's of
Okay.
the Pfizer vaccine.
Yes, here we go.
The shoulder muscle. Just going to feel a slight pinch. Across you.
I didn't even feel it.
Not even bleeding. It's good.
Not even bleeding.
And that's it.
I got a busy rest of the day and over the weekend, so I'll be calling.
What did you feel the first couple times? How did you do the first couple
I
times?
was very successful. It was like it wasn't even happening. But I was good. Stay in good shape. Okay, I think we're good.
So you didn't even flinch?
I didn't even feel it. This is how good this doctor is, Dr. Chan. That's why we're in so good shape right now, having the highest vaccinated. But we do want to be the highest boosted in the country, and we're going to continue to work that effort to communicate with people that that's our, prevention is worth the effort, right? And we don't know what we prevent unless we actually do the work that we're doing right now.
Any comparison to your other shots and the previous booster?
Well, I was very happy to take the 3 shots, but today was actually the best. It was the simplest, so that was good.
And that's what we're seeing, are very mild reactions after the shots in general. I know for myself, I did have some flu-like symptoms for 1 day after I got the shot, so I've been boosted with Moderna, received the first booster. I'm not eligible for the second booster, but most people do fine. There is that 1 day after where people tend to feel maybe a little bit off. A lot of people have nothing, a lot of people do well, but I think this experience is very typical for what most people experience.
But you find those symptoms are worth it for avoiding what could be something far more disastrous?
100% worth it. Worth it for my health. I don't want long COVID. I have not had COVID yet, knock on wood. I don't want COVID, but also understanding that a lot of people have had COVID. It is becoming endemic, but I'm not worried. I've been vaccinated. I've been boosted, so I am comfortable that I will be okay even if I do get it.
Is there still a struggle they're trying to get the message out for people to even get their first booster shot and the uptake on that?
There is. We're seeing about 40% of the population here in Rhode Island getting boosted. I will say we are still one of the leaders in the country for that, but I do want to make a plea to people to really get their booster shot, that first booster shot. It's really been shown now over the last few months that you need that first booster shot to protect you against the recent variants, including BA2 and Omicron.
So, Governor, you recommend it?
Yes, and I certainly followed the lead here, the medical reasons why. But we've got a lot more at stake, in the state as well. We want to continue to be leading the Northeast in terms of economic recovery, and we want to make sure that our students are in the classroom safely now. We're not, masks are a voluntary strategy right now for us. We want to hold on to that space because I think that the opportunities that we have in the state are really, really strong, but the health has always been our highest priority. So this is, if we have a problem with our health issues, then we're going to have trouble with our economy, we're going to have trouble in our schools, and the other broader issues that we're working on right now.
Now, Dr. Chan, some people have said that if you've already been vaccinated and you've had COVID, you don't need a booster. What do you have to say to that?
So the evidence still shows that that vaccines are really the best way to protect yourself. I do agree that once you're infected, you do have some degree of natural immunity, but really that boosted vaccine and vaccines in general is what's going to protect you. So I would still strongly recommend, and we know that natural immunity wanes over time as well. So being vaccinated and being up to date on your vaccines is really the best way to prevent infection.
Sorry.
Couple more. I was just going to say, what would be your reaction to people saying like the flu vaccine? How does this differ, and should it be that, I guess, up in the air to get a flu shot every year versus this booster?
Yeah, so we'd still strongly recommend a flu shot every year. I think one thing that we often overlook is the flu does have a lot of morbidity and mortality, certainly for older population and young children. And we'll see with COVID. It may be that we need a boosting shot every year. I think it's too early to tell. Reminded we've only been we're now second year into this, which seems like forever, but it's only been 2 years.
Kind of on that COVID fatigue question, since it's waned, and is it already? Do you think a lot of people are already like, I'm done with COVID? It's out of sight, out of mind now that Omicron seems to be fading?
Listen, I think a lot of people are done with COVID, and I think we'd love to be done with COVID, but I'm not sure COVID is done with us. So we have to keep our awareness up. We have to keep watching and being observant, and especially for new variants. And that's what we're doing. That's part of our surveillance program at the Department of Health, as the governor has talked about before as well. So we just have to watch.
So the governor didn't even flinch.
No, I didn't flinch, and we really advise and encourage everybody to, let's get the preventative treatments that we have, the vaccines we know work, and they put Rhode Island in a good spot. And if we kind of can keep on the boosters going, as the doctor said, we want to be done with COVID. We're tired, but we're catching our second breath right now with the way that with the way the state is going. But as the doctor said, we don't know whether COVID's done with us, and so why take any level of risk? The prevention right now is a point that we can take advantage of, and taking advantage of that is really going to be healthy for our state, for that, like I said, for the health, our economy, our schools, and then the broader issues that we're working on to really make sure that Rhode Island comes back far stronger than we went into the pandemic.
All right.